So hi, my name's Ian Battersby. I'm head of the internal medicine department at Davies Veterinary Specialists, and today we're in our therapy and fitness centre, which is on the same site as the main hospital, which covers a variety of different services such as physiotherapy, hydrotherapy and a pain clinic. And I'm joined today by Louise Clark, who's head of our anaesthesia department. She also leads the pain clinic, and Louise has completed a master's in pain and also is currently she's the chair of the pain council and the first vet to do that, so she's more than qualified to talk about this topic today. Today we're going to talk a little bit about the challenges in assessing the progress and pain associated with osteoarthritis in our pets. So welcome, Louise. So is there any particular area where you want to start on this? Or?
I think just an appreciation that as vets treating animals with osteoarthritis and owners who have animals with osteoarthritis, we always want to make sure that what we're doing for them is the best.
Yeah.
And we're investing heavily in time and potentially money. But a lot of the time we don't have the evidence that the treatments that we are using as efficacious as we would like to think they are. And I just wanted to highlight some of the problems that we encounter with actually assessing how these patients are doing.
Okay, so I guess you're quite right. There's a lot of time, but also emotional investment in these patients, and there's incredible things that we can do now to improve their quality of life. But there's also challenges in making sure that they are as effective as what they believe them to be. Would you agree?
Yeah, I mean, one of the issues associated with that was something that has a scientific name. It's called a caregiver placebo effect.
Okay.
And that essentially means that the caregiver,
yeah,
be that the owner or the vet, whoever is trying to improve the quality of life for that patient, can sometimes erroneously and completely legitimately be in a position where they think that a treatment should work, so therefore they ascribe, if you like, efficacy to it, even though we have no actual evidence of efficacy. And we've got quite a lot of research to show this. There's a very good study looking at, essentially it's the placebo arm of an FDA drug trial. And what they did was they treated quite a significant number of dogs with nothing. And looked at their assessment she looked at with force plate, because that was just the science that was being used. And clearly they were medicated with nothing. So nothing changed with the force plate when they were reassessed. But interestingly, when their owners reassessed them to see how they thought they'd done, nearly 40% thought they'd improved because they thought they'd been treated with something efficacious. And even worse, nearly 45% of the vets thought that they'd improved. So what I'm really saying is the objective evidence, and we know these were placebo pills, is that nothing's happened. But partly because we want to see an effect, we want to be doing the best, we can be very easily led into the belief that
it's working.
It's working,
So I guess I suppose that's a good demonstration of, if you want to believe it's working, you kind of, not fool yourself's not the right term, but it's kind of like you with some of these conditions, there's good days and bad days, and you focus on the good days rather than the bad days. And I guess the challenge for vets as well in those situations is that they may be, if they're going off a brief consultation history, they're not objectifying the information they're getting, which I think is something you wanted to talk about as well.
I mean, I think this is an area of massive ongoing research, and it's something that is developing all the time. I think it's something for both owners and vets out there to be aware of, that the brief chat, is the dog doing better, will not necessarily might give you the right answer, the answer that makes you both feel better, but it might not be the answer that the dog in the corner is thinking, actually, hang on, I don't feel any different. So there are a series of more objective measures, and there's it's a Liverpool osteoarthritis, if you like, project that's been developed by the Liverpool team. There's a load scale, which is very well validated in OA. Canine brief pain inventory. There's a system developed by the team in Helsinki. And all of these have pluses and minuses, but they're a lot more objective than just the one question.
And are these scales that they have to be done by a vet, or can owners do them at home to monitor progress? Or
some of them are available online as a questionnaire. The Liverpool one is certainly available online, and they're most of them are free access,
Okay.
and the CBPI is definitely available. You need a little bit of understanding to understand how they actually work.
Okay.
Beyond that, there's a scale or more than a scale, an online tool that's been developed by the team at Glasgow, which is called Vetmetrica, which is probably the leading edge of this research area, and that
Okay.
can be done by the owner at home with a glass of wine, and it asks lots of questions and to really elucidate what's going on, and then we can log in online and see what that says. So we can see in advance of the consultation.
Okay.
I appreciate that's not available to all practitioners, but I suppose the backbone of what I'm saying is when we're looking at efficacy, we need to look at efficacy objectively.
Yeah.
And beyond that, the other thing that tends to happen, and this always happens in any research situation, if you're being monitored, you tend to change more than one aspect of what's going on.
Okay.
So these dogs may, for instance, be having a new non-steroidal drug, but you're probably being a bit more careful about their exercise because that's what you do.
Easy. Yeah.
And you maybe decided to start feeding them a supplement because you're taking their OA really seriously. So actually, there are other changes going on in the background that maybe you haven't had a chat with your vet about. So actually the vet's thinking this drug's made all the difference when actually you're doing lots of other great things. Something you found on the internet about putting carpet down on laminate floors. So that's another thing that, when we're talking about these chronic disease things, make sure that you share all the information with the vet so that they get a really broad picture of what you're doing, because there's an overestimation of efficacy of one thing when actually you've changed loads of stuff.
Lots of things. So by using tools like this, it gives the owner, an idea of, whether things are progressively improving or whether they're, I suppose, gradually deteriorating and things need to change. But also it allows the vet, be it a specialist pain assessment clinic or a first opinion practitioner, a more global
overview.
Yes,
and that's the whole thing that unfortunately managing OA it has to be done in a holistic manner. There's changes to the environment, changes to exercise, a rehabilitation type approach, things that we do here, the hydro, the physio, all those kind of things. And we really need to be able to tease out what is objectively giving a benefit. And there is a tendency to hang on one thing, but we need to try and be as objective as we can, basically.
Okay, cool. Well, thank you very much. I hope you find that useful.